Hello everyone, Nick here. I hope this finds you well and dry after one of the wettest weeks I think I've ever lived through. And welcome to the Just Better Care Hills District Team Meeting for November 2020. We've got a lot to get through today, couple of housekeeping issues at the front, but then we're going to get into what we're calling Clinical November, which is all about how we deal with clinical matters and what happens after you guys see someone, and how our nurses and how our clinical staff then look after people and ensure they get the best care. So it's a very heavy educational outing today, and so sit back, relax. I hope everyone's doing well, and we'll get into it. Before we hit the heavy stuff, just want to update everyone. If you haven't yet, please download the MyJBC app. I'll include the links to how to download it. It's free download from your app store, be it Samsung, Android, Google, or Apple. It allows you to access all our stuff in the one place. I will say that's the intranet, your LMS, your Procura porthole, everything like that. Please do not delete your Procura app. You still need that to get through this app, okay? Your login details will be the same as Procura to get into it. Everything else still maintains the same passwords. It's just a convenient place to have all our IT in the same place. And pretty soon we're going to start communicating through it. There's a process that we can send push notifications and also upload our newsletter, which you can see in the bottom left-hand tile there. So please, if you haven't yet, please download it. Look in the email attached to this video for instructions on how to do so. Just wanted to say a big thank you to everyone who's been into the office and done their safety switch, and also collected their masks and gloves and things like that. Whilst we're still involved heavily in COVID here, being a health organisation and making sure we don't cross-contaminate anywhere, it's really good to see. Now, there is some stragglers out there, and I will say we're becoming aware that it's the same half a dozen people every month who aren't getting their stuff in. We know we're asking a lot of people, and what I'd like to ask is, if it's your compliance paperwork, safety switch, gloves, masks, anything like that, please communicate with us. If you're unable to do something, we can do our best to try to get something out to you by another worker or something like that. Now, it's not always easy for us, and we can't always do that. There is times out of office hours where I'm in the office, or we can organise to open on another Saturday or something like that for convenience for people, but we don't know you need it unless you communicate with us. So if you're having trouble doing something, please let us know, okay? Also, we're a little bit short-staffed in the office at the moment. We've got a couple of people off on leave, and we'd like to send a big congrats out to Sujatha, who's become a grandma, and she's taken a couple of weeks off in order to go spend some quality time with her family. So we're doing the best we can in here. If we're a little slow at following something up, please don't get too angry at us. And please remember, we're doing everything we can to support you. If you ever feel like you're not, please give me a call, and we will do our best to rectify that as quickly as possible. The other bit of housekeeping, and just to remind everyone, it has gone out in the newsletter before, that our Christmas party this year needs to be postponed due to COVID. Now, you'll probably hear this mentioned a couple of times during our clinical education, and Sue will probably follow it up as well. But due to COVID, it's really important not to congregate in large groups. And because we provide healthcare to so many people in the form of care work, be it social support, personal care, or even domestic assistance, congregating in one big group means that if someone's infected, we could spread that through our system here and through all our clients and everything really, really quickly and cause massive problems. So we've decided to postpone it at this stage. Hopefully, if everything happens quick, we might be able to do a Christmas in July and a Christmas next year. But in the meantime, we have organised everyone a bit of a gift. So in the next mask collection, which will be in the second week of December, and we'll give you 2 months worth of masks again, which will take you through to the end of school holidays. We'll have a present for everyone, so everyone please put down in your diaries that you need to come and see us during December then. We look forward to meeting with all of you. as I mentioned, November is Clinical November, and we want to give you some education around some things we do in the office and some people you may see but you don't know what they do and things like that. So first and foremost, we're going to have Lara have a bit of a chat to you.
What is clinical governance framework? Clinical governance ensures accountability and transparency across all disciplines of healthcare, supporting staff to ensure consumers or customers receive high standards of quality care and service provision, including quality improvements that are continuously reviewed, monitored, and implemented. At Just Better Care, clinical governance framework addresses 7 key components. Number 1, processes that manage clinical risk, quality, and safety. Number 2, systems to support ongoing improvement of clinical effectiveness. 3, ensuring workforce capability to support clinical quality. 4, developing and applying clinical guidelines that are supported by the best available evidence. 5, partnership with customers in the community, including informed consent to care. 6, customers' rights and engagement, which is equitable and inclusive. 7, deliver quality services to customers and ensure each customer is provided with a Charter of Rights in aged care, and the Charter is explained to them and their representative. What is a healthcare plan? A healthcare plan is a personalised care plan for a customer with high intensity support need. It is developed with consultation with the customer and their health professional, such as a GP or RN. This ensures clinical oversight. The healthcare plan outlines the activities required to maintain the health of the customer, who should complete these tasks, and when they should be completed. An example of a healthcare plan includes bowel care, epilepsy, and stoma care. The healthcare plans are documented so customers and staff understand the steps needed to complete the care tasks for the customer. These must follow guidelines from a health professional and JBC procedures. It's important to read a customer's healthcare plan, if they have one, and understand your role. Healthcare plans clearly state who should complete which tasks. For example, some tasks may only be able to be completed by an RN, not a community support professional. What is individualised training? Individualised training occurs when a customer has a healthcare plan that needs staff to be educated in so that they understand how to follow and implement the plan. This means that our care we provide is specific to the customer, not generic to their health concern. If you are required to complete individualised training, the Just Better Care office will contact you. What are the NDIS practice standards? The NDIS practice standards, specifically the quality standards to be met by registered NDIS providers who provide supports and services to NDIS participants. Together with the Code of Conduct, the practice standards build participants' awareness of what a quality service is and what they should expect from their registered NDIS providers. The core module in the NDIS practice standards includes rights of participants and responsibilities of providers, governance and operational management, the delivery of supports, and the environment in which these supports are delivered. What is shared care and why is it important when looking after clinical needs? When supporting a customer, it's important to remember that they may have multiple people involved. For example, the family might support the customer with some of their care needs on weekends. Shared care is ensuring that the information is shared with consent between all parties involved, so nothing gets missed. This becomes very important with clinical care. For example, if 2 providers are involved, they need to know who is responsible for what and when so that nothing gets missed. Documentation is very important in clinical care and when care is being shared. What is scope of practice and why is it so important in the way we work? It's important that you understand your scope of practice. This means working within your skill set. We cannot complete tasks that we do not have the education or registration to complete. For example, a registered nurse can administer medication. A community support professional cannot. Just Better Care scope of practice guidelines adhere to our internal policies and procedures as well as external Department of Health standards of care. 3 key factors of medication prompting. It's important to ensure that it's prompting only. A community support professional cannot administer medication, but can prompt a customer to take their own medication. It's important to provide feedback. You should document your feedback that medication prompting has occurred and that what the result was. This includes that the customer has taken the medication, or if they haven't, an incident report is required. A report is required through an incident report if any non-successful medication prompting occurs. This is like missing a dose of medication, and it's important that the customer's representative is informed and the office will do this. So please make sure you complete an incident report.
Big thank you to Lara for that. As I said before, a lot of information and a lot to come. Next up, we have our lovely registered nurse, who you may have seen out and about in the field with you, or you may have seen in the office here, and that's B. Howie. So I'll let you take it away, B.
Hi, my name is B. I'm a registered nurse here at Just Better Care. This month is a clinical awareness for support professional and clinical staff need to work together to monitor the health of our customer. Here are some tips. Tip number 1. Take a note of any changes in a customer's skin condition. When providing feedback on new wounds, rashes, describe what it looks like, including the size and color, and include details of how it occurred. Report any existing wound for changes such as color, inflammation, discharge. This is especially important for clients who are diabetics. Include a photo of the wound when making a report and always gain consent from the client before taking a photo. Tip number 2, remember each person is an individual. So what is normal for others might not be for them. Clients know themselves, so ask them how they are feeling or if anything had changed. Tip number 3, it is important that you read through healthcare plans and work within your scope. This is to protect you and the customer. Discuss any questions or concern about scope of practice with the office. Tip number 4, feedback forms are for you to document what you completed on the service and in general health and being information. If you are concerned for the health status of the customer or it is urgent, an incident report must be completed. Example of incident reports include calling an ambulance, noticing a wound, medication prompting error, and fall. Remember to keep following the COVID-19 infection control measures to keep you and the customer safe.
Thank you very much for that, B. And I just want to add on to the end there on your last point that everyone please follow the COVID guidelines, please wear your masks, please do the extra cleaning at the end, and please document it in Procura. It's really, really important that we don't let up. We're doing very well here, and the best thing we can do is not get complacent. Well, that's the end of the Clinical November part of our training, but before we go today, and I know you've all probably missed her, but a message from the boss lady, and that's Sue. So take it away, please, Sue.
Hi, it's Sue here at Just Better Care. Nice to be talking to you again. Let's hope that they get a vaccine for this terrible virus so that we can all see each other face to face. Hopefully very soon. I somehow think that this won't happen till about this time next year, but I've got my fingers crossed that that vaccine comes along much sooner. So today I'm a bit dressed up. I decided to dress up to come to work today because it's Melbourne Cup. So I hope you like the hat. I want to give you a bit of a reminder about how we work with the COVID pandemic. Just a reminder about social distancing. Make sure you stay that 1.5 metres apart from other people wherever possible. Make sure that you're using your hand sanitizer after every task that you do. So when you arrive at someone's house, use your hand sanitizer between every task. And then when you leave, use your hand sanitizer. Remember to do that extra COVID cleaning at every service that you attend if you're inside someone's house. And make sure you wear your mask. We still want you to wear masks, despite what you might be hearing in the press. We need you to keep your masks on when you're with clients, please. It makes them feel so much more confident about receiving home care services. The other thing I want to remind you about too is we know that COVID is still out there in the community, even though we might have 0 rates showing in the press, it's still active out there. So make sure you stay away from crowds or crowded places so that you don't catch the virus without realising that you're next to somebody who's not well. If you catch the virus, it means that you can't come to work and that you've got to isolate at home for 14 days at least. And it also means that it has an impact on your family. So just remember to follow all the rules and stay safe and well. Now, every year, Just Better Care Australia holds what they call the National Possible Awards. And these have quite a few categories. There are categories like the Values Champion, for somebody who's been a great mentor, for somebody with a fantastic story about a service that they've provided to customers. There's lots of categories. And this year we have 3 people who have been nominated. So I would like to congratulate Mary John, we have a certificate for you. I'd like to congratulate Eddie Choi, we have a certificate for you, and also Sue McLeod, who's working here in the office. All 3 people have shown just the most incredible performance through the past year, and I'd like to congratulate you on being nominated for these awards. We'll let you know when the winners are announced. That will be another month away at this point, as far as I know. So I hope you all stay safe. Enjoy Clinical November. I'm sure I'll be in touch with a few of you about specialised training that you're going to have to do. Bea and Lara have already talked to you during this recording about different parts of the clinical work that we do every day here at Just Better Care. So to finish off, I'd just like to say a really big thank you to everybody. You're doing the most incredible work under really difficult circumstances. COVID has really challenged us this year. It's changed a lot of things about how we work, how we interact with other people. It's not always been a nice thing to have to do, to change our systems and change the way we work. But we've got through it and we've done really well. So thank you all. Really appreciate everything that you've done this year. Bye.
Thank you everyone for joining us. As always, in the email with the link to this video will also be a link to a survey. Please fill that out, and once completed, you'll be paid at the next available pay date for your time, and that will be open until the end of next week, which by my calculation will be the 13th of November. We hope everyone stays safe and well, and we'll see you all soon. Thanks again.